This next thing I'm going to cover is called bursitis. And a bursa is a fluid-filled sac that acts as a protective cushioning at points of recurring pressure, eases the movement of tendons and ligaments moving over bones, and cushion points of contact between bones. Bursitis is the inflammation of the bursa. And then, is massage actually indicated or contraindicated? For acute non-infectious bursitis, locally contraindicates massage. Massage elsewhere on the body during an acute phase and directly on the muscles of the affected joints in a subacute phase is perfectly appropriate. So to sum it up, if somebody's having a really inflamed day, so just like with arthritis, if somebody's having a really bad flare-up with arthritis, it's probably not a good idea to actually massage them during that flare-up. But when they're starting to feel better, then it's okay to start going at those areas. But that's my biggest recommendation with that. And the bursa is basically any joint area. So hips, I've heard of a lot of people having problems in hips and also shoulders. So those are the two biggest places that you're going to run into bursitis then. So again, it's a fluid-filled sac that protects the joint capsule areas. But over time, especially athletes, especially professional athletes, it wears down over time, and then that's when people need like orthoscopic surgery and all these other different kind of surgeries if they run into those kind of problems. So there's us as massage therapists, of course, we can't diagnose if they have bursitis or not, but we can ask them to ask their doctors to check it out. And some doctors will say, oh, you got bursitis. Other ones will run many tests before they actually say you have that kind of problems. And bursitis can mimic other kind of problems too. So again, it can, for the shoulder region, it can even mimic carpal tunnel problems. So that's why, again, us as massage therapists, we can't diagnose, but have them get it checked out by a doctor just to be safe if they're running into any kind of problems. And my belief is anything over 7 days, if they're having pain, it's a good idea to have them check it out with their doctor. And it kind of releases our responsibility then too, if we let them know if it's any kind of extreme pain or anything over 7 days that you're having pain. It's a good idea to see a doctor because you want to write that in your SOAP notes, of course, too. So just to verify that you let the client know to get it checked out then. And again, if we ever don't, let's say it's been a couple weeks and they're still in excruciating pain and they haven't seen the doctor, we do have the right to refuse too, so they can see a doctor beforehand. So again, bursitis, it can be in shoulders, elbows, any basically hip area, any joint area of the body then. And again, if it's more in the acute stage where there's more of a flare-up and it's really painful during that day, probably not a good idea to actually massage them, okay? So just a word of advice, and it's, again, any kind of inflammation you don't want to massage because it could push the inflammation around even more and you don't want them ending up even worse then. So that's my recommendation, and please leave the comments in the section below. Thank you.